by primary care, we mean focusing on wellness and prevention. That is the way that we bend the cost curve. We reduce the cost of delivering health care, not only in Maryland, but in this country in the long term. If we don't bend that cost curve, then delivering quality care to more and more Marylanders and Americans will not be sustainable. So when you focus on wellness and prevention, and you have a provider, a physician, a nurse, or another provider spend time with a patient at the front end, looking at lifestyle choices like physical activity and nutrition, counseling patients on smoking cessation. We know that if we do that, we can eliminate many of the chronic diseases, or certainly reduce, that drive up the cost of delivering care, whether it's coronary disease or lung disease, whether it's diabetes or hypertension. A lot of those are related to the choices we make, what we eat, our physical activity. So when we get primary care providers spending more time with their patients, focusing on those aspects of their living, and also addressing any disease or illness up front, and not waiting until it becomes an emergency room visit, then we are going to be able to deliver quality of care at a lower price. It's not only good for bending the cost curve, but improving overall the quality of health in Maryland. Last year, we established the patient-centered medical home. The patient-centered medical home is a concept or a model where you have a primary care provider who is essentially going to quarterback the care on behalf of a patient. They'll focus on wellness and prevention. They'll coordinate any care that their patient needs with specialists and other providers. They'll rely on and incorporate health information technology to make sure that they have the right information about the right patient at the right time. All of this designed to focus on wellness and prevention and improve the quality of care for patients. As an incentive to primary care providers to adopt this model of care, we are offering enhanced reimbursements for their services. Often we hear stories that a primary care physician has to rely on a volume practice to see a lot of patients throughout the course of the day in order to basically make ends meet and keep the lights on and pay their employees. What we want primary care providers to do is to pivot away from volume and focus on that quality of care, but we also know that in order for them to do that, they need to be reimbursed appropriately for that extra time that they're spending with their patients.